Chondromalacia patella is an irritation behind the back of the kneecap. So the kneecap sits on top of the femur, which is your thigh bone, and then your femur articulates with your tibia, which is your shin bone. Those complete together to form the knee joint. Your kneecap helps improve the pull of the quad tendon, so it helps make it more efficient. You can live without a kneecap, without a patella, but your quad muscle just wouldn't be quite as effective, efficient, or strong. So that's what that kneecap does. So what happens is when you go to bend your knee naturally, your kneecap will compress a little bit and slide up on the femur. And then when you straighten your knee, it compresses a little bit and slides down toward the shin bone, the tibia. So if you have chondromalacia patella, you have some irritation to the back of that kneecap, so it can kind of rub and grind. And if you have some active inflammation in there, that swelling takes up some of the space, so it makes it feel even more compressed and bogged down, where it just kind of feels like it doesn't want to move. So if you're getting pain when you go downstairs, when you walk down like a decline, maybe you're hiking or walking down a hill, if you have chondromalacia patella and that compression, that tightness of the kneecap against the femur, you're going to get grind every time you do that motion. And so then it kind of sends some pain, either some sharp pain behind the kneecap, but honestly, more often, like a U shape above, or an upside down U shape above the kneecap in that quad muscle. You kind of feel some tension, some tightness, like your skin's a little too tight. And that's just because your kneecap is trying to move, but there's no way to make it move because there's just not enough room. So the way you handle chondromalacia patella is progressive strengthening of the quad muscle so that it stays nice and strong, because when you have pain, your quad muscle can actually shut off just a little bit, where it gets a little bit lazy, and so then it can get weaker. We don't want that to happen. So progressive strengthening, some progressive stretching, where you are just stretching out the hamstrings, the quads, the calf muscles, because all of those attach at the knee, and you don't want anything pulling in any one direction too much. And then loosening up the tension there at that patella. So you can do some massage that can help, cupping can help, acupuncture, dry needling, stretching, all of those can help. You just want to make sure that nothing is too painful, because it should be a little uncomfortable because you're stretching something, you're trying to change something, but it shouldn't be significantly painful, because pain in this instance is your body's way of telling you that it's not liking what's happening. So those are the best ways to handle the chondromalacia patella. You can have irritation in the back of the knee, but not actually have any pain. So you can have some, we call it crepitus, where it clicks, cracks, pops, crunches a little bit. We all click, crack, pop, crunch a little bit. Not necessarily a bad thing, just part of life. But you don't have to suffer through pain with it.